Ladies and gentlemen, in this particular episode, we are going to discuss about hyperthyroidism, sometimes also called thyrotoxicosis. This is more common in women than men. And going back to basics, we all have this gland in the neck called thyroid gland, which is a butterfly-shaped gland. It secretes hormones called T4 and T3, also called thyroid hormones. When the thyroid hormone levels in the blood are high, we call it hyperthyroidism, as simple as that. So let us look at the various causes of hyperthyroidism. Hyperthyroidism can be due to autoimmune causes such as Graves' disease, can be due to toxic thyroid nodules, that means some of the nodules in your thyroid gland are autonomous and secrete excess thyroid hormone. People can also develop hyperthyroidism due to a condition called thyroiditis, which is inflammation of the thyroid gland. Sometimes excess usage of thyroid hormone in the form of replacement therapy can also lead to hyperthyroidism. Some medications can also lead to hyperthyroidism, example contrast media. Also, amiodarone can lead to hyperthyroidism. So these are some of the causes of hyperthyroidism. Let us look at the various signs and symptoms of hyperthyroidism. Thyroid hormone excess leads to excess metabolism in your body. So everything goes fast. You can lose weight. You can have various other symptoms as well, such as tremor, palpitations, racing of the heart, anxiety, heat intolerance, excess sweating. You can also have frequency of bowel movement. You can suffer from bulging of the eyes if the cause is due to Graves' disease. You can have problems related to your thyroid gland in terms of size. We call it goiter in medical terms. People can develop irregular menstrual periods or fertility related issues if this were to happen in women. Men can develop problems with their breasts, and we call it gynecomastia when they develop big breasts. And the various complications are irregular heart rate called atrial fibrillation. People can develop heart failure. People can also develop heart attacks if it is really left untreated for a prolonged period of time, or if it happens suddenly and the numbers are very high in terms of thyroid hormone levels. People can also develop a very detrimental complication called thyroid storm, rarely though, thankfully. People can also develop thinning of the bones called osteoporosis if this is neglected. So how do you identify when you have any of these features? Do consult your doctor, who can do your thyroid blood test called TSH, free T4 and free T3. Sometimes to identify the cause, your doctor may also do tests such as TSH receptor antibodies, a technetium thyroid uptake scan as well. And based on these investigations, your doctor would come to a conclusion as to what the diagnosis is and treat you by using medications such as beta blockers and also anti-thyroid medications such as methimazole, carbimazole, propylthiouracil as well sometimes. And coming to definitive treatment, a radiodin treatment can be administered if your doctor feels it is appropriate, and sometimes even thyroid surgery might be appropriate. We will discuss these in other episodes. So ladies and gentlemen, I hope by watching this episode you are able to understand about hyperthyroidism, and you will be able to recognize these features if at all anybody were to suffer from these within your family, friends or yourself. Do take care.